This is our outline. First, we begin with cause of schizophrenia and signs and symptoms and similar disease. Then we talk about therapeutic methods and the prevention and the prevalent scholars. And the last one is the vocabularies and phrases of this unit. Hello everyone, I'm Lin Yan. Before we start to talk about the cause of schizophrenia, I want to introduce what schizophrenia is. The important thing we should know is that we can hear sounds, talk with others, and have thoughts and do exercise. It's all about our brain. We can do this thing easily is because our brain is working correctly, which means our mental function is normal and healthy. But what if our mental function isn't normal or isn't healthy or our brain isn't working correctly? It might be something happens in our brain and there's some trouble with it. That is what we call the mental disorder. Schizophrenia is a serious and chronic mental disorder. Patients who can think, feel, or making decisions by themselves, in which interpret reality abnormally. Schizophrenia is a combination of hallucinations and delusions. Extremely disorder their thinking and their behavior that impairs their daily functioning and can be disabling in the future. People with schizophrenia require lifelong treatment. Earlier treatment can help get the symptoms under control and before the serious symptoms develop and improve the long-term outlook. And here's the vocabulary. Please repeat after me. Schizophrenia. Mental function. Mental disorder. Abnormally. Complication. Okay, let's move on. Here's the cause of schizophrenia. But that's just the topic. But actually, there is no specific cause of schizophrenia. Studies only figure that the possibility of causing schizophrenia. following I mentioned are just the hypotheses, 假说 hypothesis, and they are genetics, brain chemistry, and the last, environment contributes. Let's start with genetics. Estimates of the heritability of developing schizophrenia is around 80%, which means 80% of the individual differences in the risk of schizophrenia is associated with the genetics. These estimates vary because of the difficulty in separating the genetics and environmental influences. The greatest single risk factor of developing schizophrenia is having a first-degree relative with the disease. Means your parents or your siblings, one of them have the schizophrenia, and the developing of the risk is 6.5%. More than 40% of the monozygotic twins, 同卵双胞胎, of those who affected the schizophrenia are also affected. For the parents, if one parent is affected, the risk is about 13%. And if both are affected, the risk is nearly 15%. The candidate gene studies have internally failed to find the consistent association with the schizophrenia, that between genetics and schizophrenia, the disease. Okay. The vocabulary is behind that. Okay. Then it's brain chemistry. The imbalance of chemistry also is the possibility of causing schizophrenia. The one is dopamine, and we have dopamine hypothesis. Dopamine is a neurotransmitter, a chemical that's used in central nervous systems in the brain to help cells transmit the pulses. Studies show that taking drugs can develop the dopamine levels on the neuron. On the other hand, the medicine to cure schizophrenia can block the dopamine receptors on the neuron and inhibit its activity. According to this, the hypothesis postulates that the overactivated of dopamine can cause the schizophrenia. After the hypothesis has been presented, a statement that mentioned to the decreased activity of dopamine on the brain also can cause the schizophrenia. But how can two opposite phenomena cause this disease? Okay. There's 4 pathways keys to the antipsychotic pharmacology. The 2 pathways is relevant to the symptoms of schizophrenia. The one is Mozambique pathway. The dopamine hypothesis postulates that the positive symptoms relative to the overactivated dopamine on the Mozambique pathway. And the other one pathway is mesocortical pathway. Recent findings shows that the dysfunction of the dopamine on the mesocortical pathway is related to negative and cognitive symptoms. So in review, in excessive activation of dopamine on the monosyllabic pathway is related to, can cause the positive symptoms, when negative symptoms and cognitive symptoms are caused by the dysfunction on the mesocortical pathway. Okay. The blue one is mesocortical is mesolimbic pathway, and the red one is mesocortical pathway. Okay. The other one is glutamate. 脯氨酸. Glutamate is an excitatory neurotransmitter. The effects on schizophrenia are not a direct effect, but the result of dopamine changes. Recent studies show that the glutamate receptors can block recent findings shows that glutamate receptors in the brain the dysfunction of the glutamate receptors can cause the disease if they are dysfunctional. The reason is, in the normal condition, glutamate will suppress the overactivated dopamine on the mesolimbic pathway and activate the dysfunction of dopamine on mesocortical pathway. This is in the normal condition. When the glutamate can pass the message, the dopamine on the monosyllabic pathway will overactivate, and the dysfunction of dopamine on the mesocortical pathway will decrease. No, the dysfunction, but the dopamine on the mesocortical pathway will decrease. Causes the uncoordinated dopamine directions of dopamine to cause the disease. But that's just the hypothesis. There's some evidence to prove the statement, but there's not true. Okay. So the last one possibility of developing schizophrenia is environment contributes. There are effects of vital life, severely abused sexually or physically, and living in the cities, being born and raised. Let's start with effects of vital life. Anything goes wrong, any bad thing happens in the pregnancy of the woman, increase the risk to developing schizophrenia. For example, infection. Any bad infection pregnant woman can get, because the inflammatory biomarkers inflowing in the body through the placenta to the baby's brain and start setting up the baby's brain, disrupting the development of the baby. And the second is having diabetes while the mother is pregnant. Epidemiologic studies show that the offspring of the mother who experience diabetes when pregnancy. It's seven times more likely to develop the risk of getting schizophrenia compared with those who were not exposed the diabetic pregnancy of the other woman. And next is hypothyroidism. 甲状腺机能低下症，这个后面会有。If a pregnant woman become hyperthyroid, the risk of schizophrenia significantly goes up. The last one is smoking. Smoking is the worst habit. It's a bad addiction. Nicotine has been shown that it can increase the risk of schizophrenia if the mother smoking while they are pregnancy. After pregnancy, if the children severely abused sexually or physically before the age of 5 or 6, the risk of getting schizophrenia and psychosis generally sky high. And the last one is living in the city, being born and raised like all of you. Increase the risk of getting schizophrenia 5%. Living in a big city is more stressful than the rural areas. These are the possibility of causing schizophrenia. And here's the vocabulary. Please repeat after me. Hypothesis. Heritability. First degree relative. Monozygotic twin. Consistent. Variant. Bipolar disorder. Correlation. Neurotransmitter. Receptor. Overactivated. Antipsychotic pharmacology. Dysfunction. Excessive. Hypothyroidism. Fetal life.
Thank you for the word, but there is the Chinese translation for the bipolar. Could you give us some more medical terms for this one? If you think someone with a bipolar, they could be very active sometimes, and sometimes very sad, not active at all. What do you call that kind of disease or disorder? Bipolar. 现在很多人懂吗？这个字中文是不是？对 ，thank you。中文叫什么？躁郁症，它是两型，要么很躁，要么很郁。躁的时候是 hyperactive， 郁症一发作 totally inactive， 连家门都出不了。躁症一发作，讲话停不下来。所以这个字 bipolar 就是现在很多一个 very common phenomenon。
Hello, I'm Kang Junchun. I will talk about signs and symptoms and next part, similar disease. Signs and symptoms, we will talk about positive and negative symptoms, phases of schizophrenia and types of schizophrenia. Schizophrenia can be described in terms of positive and negative symptoms. And positive symptoms are those that most people do not experience, but are present in people with schizophrenia. Positive symptoms include delusion. People suffer from delusion may stick to their own belief, even it was contrary to the fact. And hallucinations. Hallucinations are the sensory perceptions that are not perceived by anyone else. They can be auditory, visual, olfactory, gustatory, or tactile hallucinations. But the auditory hallucinations are the most common in schizophrenia. And third, disorganized speech. People engaged in disorganized speech may quickly jump from one unrelated topic to another, and which will say word salad, or they will repeat things another person says back to them. And disorganized behavior. People with disorganized schizophrenia will have some extreme behavior, and these symptoms range from childlike actions to aggression or even violence, often unprovoked or without reason. Or on the other extreme, they will be nearly catatonic or unable to respond to another person. And here's the vocabulary. Please repeat after me. Delusion, hallucination, tactile, auditory, visual, olfactory, gustatory, stick to, contrary, perception, perceive, aggression, unprovoked, catatonic. With the feeling or ability that is normally present in most people and are less responsive to the medication. The negative symptoms include blunting effects. People with blunting effects have difficulties in expressing their emotions. They have little facial expression, or they will speak in a monotone voice. They may be unable to express their strong emotions about the things they deeply care about in the past. And alogia, or we can call it poverty of speech, manifests as reduced speech output and reduced verbal fluency. They may be difficulties in speaking, reading, or writing, but intelligence is unaffected. Anhedonia, when people who experience anhedonia will have have reduced motivation or ability to feel pleasure. Or it can be an inability to feel tactile pleasure such as eating, touching, or sex. Asociality is a disinterest in social contact or a lack of motivation of social interaction. Or it can be a preference of solitary activities. Evolution is a lack of motivation or activity to do tasks or activities that have an end goal. It reflects the loss of ability to do or experience things. An example of evolution in schizophrenia may be the inability to care for personal hygiene. And there are three phases of schizophrenia. Prodromal or beginning phase is the first phase of schizophrenia, and men often onset at ages 15 to 25, and women are onset at ages 20 to 35. Most symptoms showed up in this phase are negative symptoms. Doctors are unlikely to diagnose patients with schizophrenia in this phase because some symptoms in this phase may be part of the other disorder, such as depression or bipolar disorder. If patient doesn't take a proper treatment in this phase, the condition will worsen. And the next phase is acute or active phase. Psychotic or positive symptoms appear, and the acute phase is characterized by hallucinations or paranoid delusion, and extremely disorganized speech and behavior. If left untreated, the psychotic symptoms will continue for weeks or months. The final phase is recovery or residual phase. This phase is resembled in the prodrome. Upwards positive symptoms subside and negative symptoms appear. The active phase may still happen again and alternating with recovery phase. There are different kinds of schizophrenia, and I will introduce 5 subtypes of them. The first one is paranoid type. The symptom of paranoid type is the most common type of schizophrenia, and delusion or hallucinations may appear. It may be developed at a later age than the other types. And disorganized type A symptom of this subtype include disorganized speech or behavior and blunting affective. Sometimes short-lasting hallucinations and delusion. It usually onsets between 15 to 25 years old. And catatonic type is rarer than the other types. Patients often switch between very active or very immobile. Symptoms can include catatonic stupor or waxy flexibility. And wax flexibility is that if someone moves the patient's body, and the patient will keep in a same posture until someone moves them again. And undifferentiated type, the diagnosis may have signs of paranoid, disorganized, or catatonic type, but doesn't obviously fit into one of these types. And residual type. Residual type is diagnosed when after the patient no longer displays prominent symptoms. Hallucinations and delusion may still appear, but their manifestation will significantly diminish. Can take pictures of this page. disease cause symptoms similar to schizophrenia, and we will compare the similarity and differences between them. And please repeat after me. Bipolar, mania, depression, abnormally, elevated, decline. Bipolar disorder is a mental disorder that causes periods of depression and periods of abnormally elevated mood, and is known as mania. The difference between bipolar disorder and schizophrenia is the duration of the disease process. A person with bipolar disorder may switch between mania and depression, and the symptoms will decline when the periods end up. But the patient with schizophrenia causes symptoms more severe than those of bipolar disorder, and is more difficult to recover. Please repeat after me. Stimulant, irritate, secret, amphetamine. And some people who abuse drugs will cause symptoms similar to schizophrenia, or it can be directly induced schizophrenia. Therefore, people with schizophrenia will be mistaken for people who are affected by drugs. Most of these drugs are stimulants that irritate brain to secrete dopamine. For example, amphetamine and cocaine. Please repeat after me. Organic. Psychosis. Epilepsy. Organic psychosis is a form of decreased mental function due to a medical or physical disease. For example, epilepsy and brain tumor are kinds of organic psychosis. Visual hallucinations are more often occurred in organic psychosis, but in schizophrenia, auditory hallucinations are more often occurred. Please repeat after me. Degenerative. Neuron. Parkinson's disease. Alzheimer's disease. Degenerative brain disease are caused by the decline or death of neurons. Degenerative brain disease usually onsets in old age. It is unlikely that schizophrenia will occur in this age for the first time. So if the patient onsets in 60 or 70 for the first time, you won't be inclined to consider schizophrenia. Please repeat after me. Abnormality. Delirium is an abnormality of physiology which causes confusion in brain function. Delirium is a common cause of some psychotic disorder, such as some psychotic symptoms such as delusions or hallucinations, delusion or thought disorder, and it may also be mistaken for delirium.
This is a very important word. Most people before they die, they also show the symptoms of delirium. So if you hear the doctor say as a sign of delirium, that means this person is going to die very soon. 出现谵妄现象，或所谓的回光返照。 disorder is also very important medical term.
Please repeat after me. Psychiatric. Duration. Postpartum. And brief psychotic disorder is an uncommon psychiatric disorder that causes sudden or temporary periods of psychotic behavior, such as delusions and hallucinations. It usually has strong symptoms but short duration.
Some women suffer from depression after delivering the baby. What do you call that? How do you say that in English? Postpartum depression. 刚才教了 depression 两个合起来，就是产后忧郁症。
Please repeat after me. Persecutory delusion. Delusional disorder is a type of serious mental disorder, and delusions are the main symptoms of the disorder. It usually onsets around ages of 40, and patient will suffer from hallucinations or disorganized speech or behavior. The most well-known delusion is persecutory delusion.
Can I move on? My name is Shanti, and I'm going to talk about the therapeutic methods. And here are the vocabularies. Can you take a picture and write it down later? Please.
Please read them over.
And please repeat after me. Therapeutic. From psychotherapy. Psychotherapy. Antipsychotics. Spasm. Twitches. Disturbance. Agitated. Ambivalence. Aggression. Constipation. Tinnitus. Hallucination. Remediation. Psychosocial therapy. Rehabilitation. And perception. Dementia.
There are two treatments of schizophrenia, and the first one is pharmacotherapy. It's a kind of it's taking the medicine to control the illness, and the second one is psychotherapy, which is a kind of talk therapy and social skills training. And doctors will choose the best medication by looking at how well it works on symptoms and how much it costs, as well as side effects. There are two groups of antipsychotics. The old one is typical or first generation, and here are the examples. And the newer group are called atypical or second generation, and here are also some medicines. I'm going to talk about the difference between the first and second generation. There are three differences. And can you guess in which year it's used to separate them? Please raise your hand. Oh, Lisa.
Which year?
Yeah, which year?
1999.
No, almost.
2000.
Eh,
2005.
No. Hảo, Lisa.
1998.
No.
Plus or minus?
Minus.
1966.
No. Does anyone know?
No. Take a break. 1990.
Yes. The first generation is before 1990, and after it is second generation. And the second difference is, if you take the first generation medicine, you will more easily to suffer from the extrapyramidal symptoms. And the third difference is, the second generation is more expensive, but it has less side effects. And these three kinds of medicine are long-lasting, and it can be given by injection in order to prevent from the trouble of taking medicine every day. And I'm going to show you the side effects of antipsychotics. The first one is movement irregularity. This could include the extrapyramidal symptoms such as muscle spasm, 痉挛, or the twitches, 抽搐. And the next one is sleep or appetite disturbance. Any extreme behavior in sleeping or eating patterns, and it's a sudden change in usual sleeping cycle or appetite. And the third one is sexual issues. Either inability to have sex or an unusual level of desire. And the mood problems is that feeling agitated or restless, and acting out aggression or verbal abuse. The next one is thinking problems. It's being unable to change their focus, like saying the same words or making same action over again and again. And the body change includes constipation, headache, tinnitus, and breathlessness. And I'm going to introduce psychotherapy. Here are 3 types of psychotherapy, and please repeat after me. Individual psychotherapy, cognitive behavior therapy, and cognitive enhancement therapy. And during sessions, a therapist teaches people how to deal with their thoughts and behaviors. And it also tells the patients more information about the illness and effects. Moreover, they will teach them how to manage their life well. The cognitive behavior therapy is to change the people's behavior or thoughts. And therapists will show the way to the patient how to handle the hallucination. And therapists will also tell the patients what triggers the psychotic episode and how to reduce or stop them. The next one is cognitive enhancement therapy. It also called cognitive remediation. It teaches patients how to recognize the social cues and improve their attention, and it combines computer-based brain training and group sessions. The next part is types of psychosocial therapy, and please repeat after me. Social skill training, rehabilitation, family education, self-help groups, coordinated specialty care, and social recovery therapy. If a person sees improvement in psychotherapy, and they will need more help of getting along with community. And that is why psychosocial therapy comes in. And the social skill training instruction is to improve the communication and social interaction. And schizophrenia usually develops during the year we are building our careers. So it may include job counseling and education of money management. The third one is family education. The knowledge of schizophrenia can help friends and family who suffer from it. Research shows that patients with strong support do better than those without encouragement of friends and family. And the next one is self-help groups. It is good for patients to participate in the community care or outreach programs. And the National Alliance on Mental Illness is an outreach organization that offers peer-to-peer programs. The next one is coordinated specialty care. This is for the first time who suffer from the schizophrenia, and it's a team approach that combines medication and psychological therapies. And the last one is social recovery therapy. It focuses on setting and achieving goals, and as well as building the optimism about themselves and others. And here are the vocabularies. I'll show you.
Constipation.
Okay, let's start our presentation. Now I'm going to talk about the prevention of schizophrenia. Actually, there's no method can really effectively prevent the disease. But some principles can reduce the risk. For example, don't abuse psychoactive substances like smoke, alcohol, amphetamine, and ecstasy. Second is, don't make yourself stressful. Studies show that before the onset of schizophrenia, there was a higher proportion of stressful events. Then don't overlooking of social activity. Patients of schizophrenia tend to social isolate before onset. Don't like to social networking, like to be alone. Usually think about abstract things. Social isolation and deprivation do bring out the distortion of perception. And for the last one is keep your eating and life regularly. And for the patients who suffer from schizophrenia, to prevent the recurrence of schizophrenia, to prevent the recurrence of schizophrenia is closely related to stopping drug therapy. Therefore, to prevent the recurrence, it's necessary to maintain the low-dose drug therapy after symptoms are relieved or improved. The first one is get ready for the long-term treatment. And the second is follow the rules. Do not stop or adjust the dosage of the medicine by yourself. And third is having the proper management of emotion. And the last one is keep regularly tracking of the condition. Means you have to talk with your doctor and see the doctor regularly. Talk about your condition and talk about how you feel after the therapy. And the most important is facing the facts of getting mental sickness and learning to coexist with it. Thank you.
And I'm going to show you the related scholars. Does anyone know who proposed the terms of schizophrenia? Please raise your hand. It's an easy question.
The last one.
Yes. And who called urgent plural and propose the terms of schizophrenia. And schizophrenia, which translates as a sleeping of the mind, and it comes from the Greek root schizin. It means to split, and the phren, it means mind. Was coined by urgent plural in 1908 and intended to describe the separation of function between personality, thinking, and memory, and the last one is perception. And American and British describe the main symptom of Bleuler's class as 4A. And the first one is blatant affect. The second one is autism. And the third one is impaired association of ideas. And the last one is ambivalence. And Bleuler realized that the illness was not a dementia because some of his patients improved rather than deteriorated, and thus proposed the term of schizophrenia. And here is the last question. Does anyone remember what is the true treatment of schizophrenia? Please raise your hand.
Very good, that's a good question.
I have told it before in the vocabulary. In English.
Pharmacotherapy.
And the next one.
And psychotherapy.
Yes, and please repeat after me. Pharmacotherapy. And psychotherapy. And the last part is vocabularies and phrases.
Repeat after me. Marijuana. They were convicted of possessing large quantity of marijuana.
They were convicted of possessing large quantities of marijuana. Be convicted of.
Schizophrenia.
Geneticists regard schizophrenia as a complex disease. Geneticists regard schizophrenia as a complex disease.
Those are the people who study genetics. We call them, once again, could you repeat the word?
Geneticists.
suffix "ia" means disease. Please repeat after me. Hypochondria,
hypochondria,
leukemia,
leukemia,
pneumonia,
pneumonia,
acrophobia,
acrophobia,
amnesia,
amnesia,
aplasia.
aplasia.
And let's move on. Cocaine.
Cocaine.
He is alleged to have collected cocaine from Singapore.
He is alleged to have collected cocaine from Singapore.
The disease causes paralysis and uncontrollable tremors. The tremor was felt as far as 200 miles away.
The tremor was felt as far as 200 miles away.
The root "trim" means shaking or vibration. Extreme, tremble, tremendous, tremulous, monitoring. Formulate.
Formulate.
She could not formulate his ideas in a few words.
She could not formulate her ideas in a few words.
We formulated our own strategy.
We formulated our own strategy.
Contribute. This new discovery will contribute to all humanity.
This new discovery will contribute to all humanity.
The company agreed to contribute some money to charity.
The company agreed to contribute some money to charity.
The prefix "com" means together, and surface tribute means give, pay, or assign. Concentrate.
Concentrate.
Confederate.
Confederate.
Congenial.
Congenial.
Congregate.
Congregate.
Attribute.
Attribute.
Distribute.
Distribute.
Tribute.
Tribute.
Mail distribution.
Mail distribution.
Manifest. She doesn't manifest much desire to join the party.
She doesn't manifest much desire to join the party. Fear was manifest on his face. Fear was manifest on his face.
We learned about the noun for manifest. hearing matter formation, or was it? Manifestation. 从它的身份上。
The prefix man means hand, manacle, manicure, manuscript, script, manipulate, maneuver.
Very good. Those are very good words. Common, useful, and practical. Manual 手册 ，manual 这个字很多人都念错。manual 把它打在窗户上面 ，manual 手册。所以修手指甲的叫 manicure， 那修脚指甲的呢 pedicure。满大街都是在修甲美甲。manual。手册，使用手册 ，microwave manual。That's a very good phrase.
Symptom. A fever is a symptom of illness. The right can be considered a symptom of political instability. The prefix "syn" means together or at the same time. Symbiotic, symmetric, sympathize, symphony, symposium.
prescribe, it means the doctor says what medical treatment that someone should have. And please repeat after me. The doctor prescribes some pills. The law prescribes that all children must go to school. And here are the vocabularies. And please repeat after me. Prescriber. Prescription. Prescriptive. Prescriptivism. And pre means before, in advance of, or early. Predict. Prevent. Precede. Preamble. Precaution. Predestined. Prelude. Preliminary. And can you take a picture and write it down later? Please. I'm going to move on. Suspicion and feeling doubt or no trust in someone or something. And please repeat after me. Her behavior was very suspicious. His colleagues became suspicious when he didn't appear at work, since he was always punctual. And the synonym and antonyms of suspicious. Please repeat after me. Apprehensive. Doubtful. Incredulous. Skeptical. Mistrustful. Leery. Certain. Confident. Undoubting. Sure. Trusting. Convinced. The next one is mental. It means relating to the mind or involving the process of thinking. And please repeat after me. The family has a history of mental disorder. A doctor was asked about the mental state of the president. And please repeat after me. Mental arithmetic. Mental block. Mental cruelty. Mental handicap. Mental illness. Mental health. The next one is isolate, and it means to separate something from other things. Please repeat after me. A high wall isolated the house from the rest of the village. This policy will isolate minority groups and prevent integration. And the synonyms and antonyms: confine, detach, insulate, sequester, segregate, combine, link, gather, unite, connect. And please take a picture. Thank you. And the next one is proceed. His lawyer has decided not to proceed with the case. Preparations for the exhibition are not proceeding smoothly. And the next one is resemble. Please repeat after me. You resemble your mother very closely. After the earthquake, the city resembled a battlefield. And re means 在 否定、相互重新跟报仇。And please repeat after me. Retaliate. Sorry. Reshuffle. Reconcentrate. Rehash. Rejuvenation. Requite. Revive. Reconcile. Reconcile.
这个是一定要面对 reconcile with something， 退让、折中、妥协。reconcile。
And the next one is fill out. It means add information in empty spaces or official documents. Please repeat after me. Fill out the form, please. She had filled out a little things I had left in her. And red flag, it means a flag used as a sign of danger. Please repeat after me. You are not allowed to swim when the red flag is flying. You are not allowed to swim when the red flag is flying. Thank you.
Here's the phrases. Suffer from.
Suffer from.
He suffered from poverty all his life.
He suffered from poverty all his life.
Medicate themselves.
Medicate themselves.
Many birds and animals are born with the ability to medicate themselves.
Many birds and animals are born with the ability to medicate themselves.
Drug abuse.
Drug abuse.
Drug and alcohol abuse contributed to his early death.
Drug and alcohol abuse contributed to his early death.
Solvent abuse.
Solvent abuse.
In reality, however, volatility levels in emerging markets now nearly match.
Volatility levels in emerging markets now nearly match
those in developed markets. In reality as well in them. Antipsychotic drugs. Low dose of antipsychotic drugs are not as effective as higher dose maintenance therapy.
Low dose of antipsychotic drugs are not as effective as higher dose maintenance therapy.
In preventing relapse. Psychotic. Psycho. Side effects. Does this drug have any side effects? A side effect of the new law is that fewer people will take out insurance. Attempt suicide. The majority of people attempt suicide repeat that attempt until they succeed.
The majority of people attempt suicide repeat that attempt until they succeed.
Slow motion. They show the goal in slow motion. Thank you for listening.